Hi, I'm Dr. Haseeb Hassan, consultant neurologist and epilepsy expert from Kolkata. Today we'll discuss regarding do's and don'ts in epilepsy. If you are an epilepsy patient, don't get disheartened. There is not much restriction from the activity of daily living. You have to follow only certain rules. Number one is that you should not skip your medicines because skipping medicine can precipitate seizures. Your sleep should be regular. You should not deprive yourself from the sleep because that also can precipitate seizure. Have a healthy lifestyle. Take a regular healthy meal. Avoid any kind of addiction including alcohol that can precipitate seizure. Avoid stressors and maintain a daily healthy exercise regime. Apart from that, you are able to do everything except for certain restrictions that you need to follow. Regarding driving, if you have an active seizures, you should avoid driving. However, if you are seizure free for more than 3 years, you can consult your epilepsy expert or your doctor regarding guideline for epilepsy because it can differ from epilepsy type to epilepsy type and from country to country. You should avoid contact sports like boxing. Otherwise, any other sport you can play. You should avoid adventurous sport unless and until you have been specifically recommended for this by your doctor. And you should avoid operating in an area which requires risk like means high rises, near fire, as well as in machinery in an industry where heavy machineries are moving. For parents of epilepsy or maybe near and dear one caregiver of epilepsy patients, you have to ensure that these are the things which are followed by your patient so that they minimize their risk of having breakthrough seizure and its consequences. Even if they get a seizure, don't panic. You ensure that the patient is brought to safety. Like example, if they are at the edge of the bed, you can bring it to the middle of the bed, or if they are just throwing a seizure and their hands are moving, ensure that there is no sharp object near them. Ensure that when they are seizing, that the mouth is clear from any particles. So if some food particles are there, you can swipe it out. Make sure that the neck is not suffocated. Like if any tight clothing is there, like tie or dupatta, you just loosen it out. Take them to the recovery position, means in a position where they are turned to one side, the saliva is drooling out, they are not aspirating it. And don't restrain them. If they are seizing, don't restrain them. Don't try to put anything in the mouth. Wait patiently. Most of the seizure usually stop in 1 to 2 minutes. Once the patient recovers, then only you give something to eat or drink. You don't try to put water when they are drowsy, unconscious, or still they are actively seizing. Rarely it can happen that the seizure has not stopped for more than 5 minutes. That could be a medical emergency, but don't worry, that happens very less often, means maybe once in every 100 or 200 seizures patient this can happen. If the patient has seizure more than 5 minutes, we immediately call an ambulance, take the patient to the local nearest emergency which can be managed. And if you have been prescribed what is known as the emergency medicine, which in India comes usually in the form of nasal spray, you can apply it as per the instruction of your doctor. But whether you have to use that medicine or you don't have to use medicine, you ask your doctor before this one and be prepare yourself for emergency if it happen.